A very good morning and thanks for your time. So just give us an idea, because, we hear so many different stories when it comes to the impact of this lockdown on dealing with drug addiction. Some say it has made it worse because now, they're idle, they're frustrated, they're dealing with stress. Others say it might have helped people get to that sober point a little quicker because not having access easily to drugs, or not being able to go out and buy them, has actually helped them on that path to getting clean. What have you noticed? What have been your observations?
I think both observations are correct. For some people, it has helped to slow down the progression. It is more difficult to get alcohol and drugs during the lockdown, and that's helped certain people to slow down the rate at which they're drinking and using drugs. But I think people that are already addicted are making a plan. People are, the drugs are illicit anyway. And so the fact that they're now outlawed hasn't changed anything. People are operating outside the law, and drugs and alcohol are still freely available if you know where to find them.
So if we have to look at just the process of helping somebody along the road of sobriety, like you're a rehab centre, you provide the support,
yes.
You do whatever it is that, it's not just, okay, today you stop taking drugs. It's a process. How has the lockdown affected your process, if at all, in helping them actually get started for somebody who maybe might have just come to you at the start of lockdown?
I think there are some unique challenges being presented by the pandemic, by both the lockdown and the pandemic in general. So our procedures have all had to be changed and modified to accommodate COVID-19. We have to be screened and tested before admission, and then we've had to reduce our numbers to accommodate social distancing and sanitize everywhere. And then even in, there's a lot of emphasis on group therapy, and those group therapy sessions are now socially distanced and with masks. And so those are some of the challenges to offering treatment. But also, post-treatment, we often say the opposite of addiction is connection. Addiction is such an isolating process that by the time it may start as a social pastime, but by the time the addiction sets in, people are alienated and isolated from their families and from their social groups. And so it's important that they connect with a new group of people. And obviously with the restrictions in meetings and people's ability to access support, a lot of our stuff's gone online. A lot of our support groups have gone online, but they're a poor replacement for face-to-face and for social interaction.
Have you seen an increase in the number of people who are addicted because of lockdown? I mean, at the start, we spoke about, people who might have resorted now to and it all starts sometimes with painkillers or an addiction to sleeping tablets, and then you need something more. For people who've had to deal with this lockdown, deal with, demands of working from home, deal with just sitting idle and being frustrated and being stressed about what's going on, have you had people come to your rehab centre, or have you heard that it's driving more people to addiction and to places like yours?
Yes, I think it's pretty clear that people are turning to drugs and alcohol to medicate their stress. Everybody's under a lot more stress, being locked down, financial insecurity, not knowing what the future holds is obviously creating anxiety for everybody. And certain people are turning to drugs and alcohol more and more. We don't have any research on that yet. It's too soon, but certainly plenty of anecdotal evidence of people now seeking admission to helping organisations, saying the lockdown was the straw that broke the back.
And I want to talk specifically about the alcohol ban and the ban on cigarettes as well. Do you find that has also created a bit of a negative impact? People are not able to get their hands on maybe just, a bottle of wine, something that would have helped them unwind at the end of the day, or not being able to get their cigarettes. So they are finding other ways. They're consuming other things to actually cope.
Yeah, I think there's been good and bad. I was kind of quite concerned about the ban initially because, alcohol-dependent people can't just stop drinking. There's a medical implication. There's a health risk to people just stopping once they're physically and psychologically dependent on alcohol. But as you say, those people either made other plans or still managed to get access to alcohol, or took other medications to alleviate the withdrawal. But I think that the positive side of that is it did slow people down. You know, making it harder to get access to alcohol will slow down the progression of people's drinking problems. What we saw, though, was as soon as the alcohol ban was lifted, there was a very quick progression back to where they had started from before the lockdown. And I think that you know, when the alcohol ban was lifted for a period of time, you did see there was quite a significant reaction to that, not just from people with alcohol and drug problems, but from people generally in the population. So I think it's good and bad.
And, you know, Alex, you spoke just a short while ago about having to go online. Many of your support groups now, people having to have Zoom meetings like this and talk. How has that worked? I mean, has it been successful? Because often that human touch, being in the company of others, you're able to also judge whether somebody is being completely honest, whether they are on track and are doing what they say they're doing. Has going online sort of taken many people a couple of steps back in terms of getting the support they need to get through this?
Yeah, there's no doubt about that. That it's you know, the first 2 weeks was probably sustainable. People managed. They you know, it wasn't the same, but it was kind of something. But as it's gone on, so people have dropped off. It's much more difficult to access the support and help that you need online as compared to face. And I certainly think that that's had a huge impact on people's processes, on their ability to recover, on their ability to get the support, and as you say, the care and the personal and human contact. And that will affect their prognosis. There's no question about that.
So give us some examples of what you've seen actually happen to people in this time. I mean, we even hear of stories of people who've gone as far as attempting suicide because they're unable to cope with this, and you know, obviously not being able to slowly wean yourself off this, not getting drugs, because that is the process, isn't it? You kind of put them onto other things, and then it moves on to something that is less effective and less effective until they've managed to kick this completely. So just some stories from your side of just the worst case scenarios and what's happened in this time.
Well, I think, you know, the level of stress is putting everybody under quite significant difficulty. And so obviously if you have a pre-existing drug problem, it's only going to exacerbate the situation. We have had suicides of people. We have had people overdosing. It's also very difficult to get help. You know, more difficult than it has been. And so, you know, there have been some terrible consequences of people overdosing and being hospitalized because they're not able to access the help that they normally would be. But also I would imagine that we will see when the dust settles that there's been a far higher relapse rate amongst people in early recovery, amongst people who are, you know, taking the first few steps. And I would imagine even some people who are in stable remission. But those are anecdotes rather than evidence. And I think that I'm pretty sure that's going to be the case.
It's a bit of a mixed bag, as you say there, Alex. The good and the bad have come with this pandemic and the restrictions as well. Thanks very much, Alex Hamlyn. He's the founder of Houghton House, a rehab centre.